Antimicrobial resistance has really important impacts on animal health and on public health. When patients are infected with resistant organisms, they have longer time to recovery, higher treatment costs, and higher likelihood of treatment failure. And also, these resistant organisms can be exchanged between animals and their human companions. So lots of impact of these resistant infections.
Some of the most concerning pathogens and antimicrobial resistance patterns that we're seeing in veterinary medicine is increased resistance to extended spectrum cephalosporins and fluoroquinolone antimicrobials, and very concerningly carbapenem antimicrobials as well. And as we start to see more of these resistant infections in our patient population, we need to start using antimicrobials of last resorts more often. And this is a very concerning trend that we need to make a high priority in fixing. To combat this problem of antimicrobial resistance, what we've always done in the past is to create and market new and novel antimicrobials. However, over the past 50 years, this has really rapidly declined, and we can't rely on that anymore to fix this problem. Currently, what a lot of veterinary hospitals are doing are creating antimicrobial stewardship programs to ensure that we're using antimicrobials judiciously so that we can safeguard them into the future. And coupled with these programs are environmental surveillance, looking at antibiograms to see what type of resistance profiles we're seeing in our clinical cases. We will do antimicrobial use guidelines to help direct and guide in empirical treatment choices. And also with these programs, a big component of it has to be infection control. As we have fewer infectious diseases, we'll be able to use antimicrobials less often, and then we can have less resistance in the population.
Antimicrobial resistance is one of the great health problems of our time because it affects not only our veterinary patients, but also the public health in general. So antimicrobial stewardships provide guidance and guidelines of active steps that veterinarians, the veterinary medicine in general, can apply to protect the future efficacy of antimicrobial drugs.
In addition, we can think of novel therapeutics that we could use for treating these infections or to use in collaboration with our antimicrobials. So topical applications, localized applications of antimicrobials instead of systemic applications, and also probiotics and other type of things that we can use in order to reduce infectious diseases.
With your help, we can keep antibiotics useful for both animals and humans.